And welcome back. Infirmary Health has been implementing robotics in its surgical procedures, which comes with several benefits for the patients and providers. We have a special guest in the studio to tell you more about this procedure. Chris Dyas, a surgical specialist at Mobile Infirmary. Thank you for spending time with us on the eve of the holiday.
Well, thank you. Thank you. Looking forward to a good holiday.
Yes, I hope you have one, everyone as well. So we're talking about Da Vinci 5.
Da Vinci 5, that's the newest robot from Da Vinci. You know, we've been doing robotics at Mobile Infirmary since 2006. We've gone through several different upgrades, and now we have the Da Vinci 5, which is the newest and latest and best.
Awesome. So how does it work?
Well, when you tell somebody you're going to have robotic surgery, or they're going to have robotic surgery, they have in this mind this robot's doing the operation, but that's not what happens. Really, the surgeon sits in a console, and he has his head in the viewer, and every move that I make with my hand, the robotic arms do. It's really an advancement from laparoscopy, where we used to stand at the patient's side, put ports in and put instruments in, and we could, you know, move our hands like this. But those instruments can only rotate and open and close. With the robot, every move I can make with my hand, the end of the robot, the hands of the robot can do the same thing. So it's much more versatile, much more accurate, and it's better for the patient. Yeah,
I was going to talk about that accuracy, because when you're able to have that movement that mirrors your hand, I mean, that is quite the evolution, right?
It really is. It really is. And if you think about operating at the end of the abdomen, for example, fixing a hernia, repairing a hernia, you're throwing a stitch with an instrument before that did this, okay? But you're sewing against a flat wall, basically. And so you need to be able to turn your hand and put the stitch in more accurately. It can be done the old way, but it's just so much more accurate when you use robotic surgery.
So I want to elaborate on that, because it really is a benefit to the patient having this robotic procedure instead.
Well, that's true, and laparoscopy, as everyone is aware, is so much better for the patient in terms of wound care and wound infections and getting out of the hospital. And robotics is just the next step beyond that. It has the same advantages of limited incisions, but the accuracy inside the abdomen, the visualization is so much greater. The accuracy with where you can put a stitch and where you can grab things. The visualization with the monitors now, with the cameras, the advanced cameras, it's amazing where we've come. You know, back when I trained, we made incisions and we operated on everybody. Then it became laparoscopy, and we thought, oh man, this is great.
Yeah, I know. It was like, wow.
And now robotics, you know, and then every step of the robot, every new robot is so much better than the one before. It's just incredible.
Now, in doing research on the Da Vinci robotic system, there are a number of surgeries that this is used for. Oh,
yes. So obviously I'm a little favoring general surgery, because that's what I do, but you know, urology, GYN, we do foregut surgery with the robot.
I'm just curious, I love technology, I do tech reports. When it comes to learning how to utilize this, was that difficult or easier?
It really depends on who you are. The younger people that played video games when they were younger, they tend to pick up on laparoscopy and robotics a lot faster than, say, the old guys, even older than me, if you can imagine. You know, it takes them a little longer. But once you get it, I mean, you've got it. And it's just, it almost becomes second nature to you. You're not even thinking what your hands do, and you're just thinking about doing it, and it's like your hands are in the patient's abdomen doing the work.
Yeah, and still a great level of responsibility.
Well, it is.
Yeah. Well, is there anything else you want to add?
I can't wait to see what the next generation is. We just got this generation, so I'm still very excited to use it. And I think about, well, if we've gotten this far in just the 20 years that we've been doing robotics at the infirmary, if we've gotten this far in 20 years, where are we going to be in 20 years from now?
Oh, wow.
It's amazing. I don't know if they're going to take my job one day with robotics.
No, we're not going to put that out there.
But there is an advantage that, another thing with the Da Vinci 5 I didn't mention is that you can now pick up my cell phone and punch into the operating room if one of my partners is having an issue and wants an opinion. I can see everything that's going on in their screen on my phone and talk to them while they're operating, which is something that's unheard of before. So.
Thank you for stopping by.
Well, I appreciate you having me.
Absolutely. This is a really neat technology right here. We'll have